Today we're going to talk about how to build an e-visit solution leveraging Microsoft 365. And we're going to focus on a number of the tools that are in 365 to help build an e-visit solution. But first, let's talk about why do we need to do this? And the challenges with COVID right now, it's very hard for patients and loved ones to connect personally as you would normally. And hospital systems are having to come up with creative solutions to connect family and loved ones. Now, there's a lot of stuff out there. We have Zoom and we have, our mobile phones and we have all kinds of stuff. But from a healthcare perspective, there's a lot of challenges that healthcare systems have to worry about, such as scheduling, managing resources, having the right equipment at the right time available, getting folks to take that equipment into the rooms and set it up, then sanitize it, doing those scheduling of those resources, and then having reporting available of the efforts that were made. And so you can go back and see, from a governance perspective, that you were following all your best practices as well. So it's not just about, getting, something like Zoom or WeChat in the hands of grandma so you can call her. It's more about the healthcare system having to manage the whole process, but do it seamlessly enough so that anyone at any point can schedule an appointment with a patient at a healthcare system, whether that be a hospital or nursing home, and be able to connect and do so with governance and reporting and making sure that all the different processes were followed. So luckily, there's some really great tools within the Microsoft 365 suite, such as SharePoint, Bookings, and Teams that can really help you set up and manage an enterprise e-visit scenario. So today, what we're going to do is I'm going to take you through scratch how to build this and the different considerations you need to think about. And we're just going to do a quick prototype and I'm going to walk you through it. So I'm going to jump over to my 365 environment. So here I have my kind of generic 365 environment that I've set up. And we're going to go ahead and I'm just going to go ahead and start. Let's go ahead and create a new booking. But before I do that, I'm getting ahead of myself. Let me actually give you a quick overview of where to get bookings and what it is. So today we're going to focus on probably just two technologies, which is Microsoft Bookings as well as Microsoft Teams. And Bookings is a really underutilized tool that's part of this vast application library that's part of 365 that not a lot of people use. And it was originally designed for folks who have things like, I don't know, maybe you're a barber or you're a masseuse or someone like that who needs to schedule appointments and come up with a really easy way for individuals to click on a link and schedule an appointment. Maybe you're a lawyer, whatever the case may be, where you're doing something in a chunk of time for an hour. But as the solution has matured a bit, it also integrates tightly with other aspects of the 365 suite. So when you start thinking about business processes where you have a scheduling component, all of a sudden Bookings becomes very popular and it's very easy to set up and integrates pretty nicely with the rest of the 365 applications. So Bookings is the piece where we're going to set up the scheduling, but also then we'll use Teams for the conferencing. And within Teams, there's the free license that consumers can access now. So there's not a lot of overhead from licensing for the healthcare system. It's becoming very popular. There's something like 78 million people on Teams right now. So a lot of folks use it at work, and now they're trying to promote it more for consumer use as well. So, but at the same time, it also tightly integrates with security pieces as well. So it's a very secure option to connect. You don't have to worry about, folks in China getting a hold of personal data. It's all very secure. And Microsoft does a really good job of keeping that all locked down. And they integrate really tightly together. So what I'm going to do is I'm going to start by creating a new, what we call a new bookings page from scratch. So I'm going to go here and I go new. Now again, the way I got to bookings is you go up here to the waffle. And if anyone ever, this is what we call it, these little 9 dots in the left-hand corner when you log on to 365. It is the waffle. And you go to bookings. Now, more likely than not, you should have bookings. And if you don't see it here immediately when you click on the waffle, go to all apps and look for it there. You can also search for it. If you don't see it embedded here within the available apps, you might want to reach out to your Office 365 administrator at your company and ask them to enable it. Sometimes Bookings is available, but they just simply didn't check the box to make it available to the employees in the organization for whatever reason. So more than likely your company, if you have 365 already, has this licensed, but it is possible that your administrator would have to go in to the admin panel and set it up. So again, though, we went here to the waffle after you log into 365. We go to Bookings, and you click on Bookings, and it'll take you to this generic page. Good morning, your name, and it pulls it from your ID here, and you get to start from scratch. So I'm going to go here and go New, and I'm going to create Wonder Healthcare. That will be our new organization. And healthcare. Great. Continue. Oh, did I spell that right? There we go. Now it's going to go through and create a booking site for us, but it's actually doing a few things in the background. It's also creating a master calendar and a Office 365 group that you'll be able to leverage for all these different scheduling purposes. So it says your bookings calendar has been created. Use the staff page to add additional staff members. Great. So now, if you see, there are a few different bookings here available that we have created. So you can choose different ones. But right now, we're going to focus on our Wonder Healthcare. And I'm going to do a few things. I want to add a logo. Let's spice this up a little bit. So I'm going to go here. I've created a nice, lovely logo for Wonder Health. And I can choose the background color. I'll just make it white based on my logo. So that's nice. Hit save. Great. And it just, because I'm the administrator, it just let me know that the calendar was created, which is helpful. And here is the calendar view. We're going to come back to this in a second, because for the folks who are coordinating all the different visits, this is going to be where they're going to see everything. But I'll come back to that in just a moment. Now, one of the first things you want to do is you want to set up your staff or roles. So when you think about staff and you think about e-visits, there's a couple considerations. Odds are you are going to have a piece of equipment. That equipment could be as something as simple as a phone that you're going to take in when a visit's scheduled, or it could be a full video conference solution that you're using Microsoft Teams with. Different organizations have different pieces of gear. Also, you're going to have someone who's going to be responsible for that. So generally what you would want to do is you would want to assign a specific resource, and then that resource would be accountable for that gear. So it kind of has to be sort of a one-for-one relationship where you have a resource who's actually going to go in, wheel in the cart or whatever the configuration is, or bring a phone, and then when they get done, sanitize everything, of course, and then move on to the next appointment. The great thing here is when you define your resources, so here I have a few different folks, Angela, myself, Perry, and some other random emails I've added. You can go ahead and set up different resources, and these resources could actually be in different buildings that they're accountable for. But I want to say, these are my different folks, but you could add just few as 1 or 100 different folks, and then when you set up your service, you can depend on who that staff is. Maybe you have a group of folks in facilities who are responsible for doing this. You just want to make sure that you add them in the staff panel, so that then later on, when you're scheduling these appointments, they're getting notified on their mobile device, on their calendar, that they have to take the video cart into this building at this room at this time. So you want to go ahead and add your staff. And again, you just do that here, and you can just go to add people. Like I'm going to, type in my name. Oh, there I am. Bam. There are my initials automatically. You can color code them. You can put in their phone number. You can make them a guest, a viewer. You want to make them a viewer because they want to be able to see the calendar appointments. This is also kind of fun too. You can also set hours for different resources. So let's say that you have temporary resources that only work perhaps on, I don't know, Monday and Thursday and Friday and Sunday, hypothetically. And then you can say they work, I don't know, from 8:15 to 4:40. You have a lot of variety there. Now, what this does is later when folks go into schedule, if that resource isn't available at that time, it won't let you schedule it. Or if their time's already booked because of an appointment, you don't get to schedule it. So it really gives you a lot of flexibility in terms of how you manage your staff who are going to be resources when setting up these e-visits. And then, yeah, notify staff. So the next thing is when an appointment happens, you want them to get an email as well. So then I'm going to hit save. Oh, I already exists, but just as a demo, I'll go ahead and discard that. So yes, there I am right there. But, you know, and again, this could be one resource or it could be hundreds. It really doesn't matter, but there's a lot of flexibility there. Next, I'm going to go here to my services. Now, this is really important. And what we're going to do is set up a new service. Now, think of a service is we're setting up a service for e-visit, but this could be anything. This could be any sort of activity that's going on within your system. You could have different types of e-visits. You could have e-visits set up for different buildings. Perhaps you have resources at the nursing home or at a clinic or at the hospital. You can set up different services based on the location of where that patient might be. So I'm going to just, you know, this is going to be catch-all service. And it's going to be the default location, but I could, you know, give it a location. There we go, Seattle, Washington. And this is very important here, add online meeting. So what this does is when you generate, when someone goes in and schedules an appointment, it automatically generates a Teams meeting for that e-visit. So now they don't have to use it. They could say, oh, I just want to do a phone call, but it's just best to have this set for everyone. Now, this is very important here. How long are these e-visits? So let's say, okay, they're only going to be 30 minutes. But here's a great thing. You need to give some time to your resources to have a buffer on either side of the appointment to make sure that they can sanitize the cart and get to the next appointment. So you can say, okay, great. An e-visit is 30 minutes or 60, whatever you want to be, but I want to make sure that the resource who is bringing in the video conferencing or the phone or whatever it is has enough time to get in, make sure that your loved one has, you know, enough, you know, experience or they know what they're doing in terms of how they're going to communicate, you know, little overview or training, if you will. And then they also have another 15 minutes to sanitize the cart and get to their next location. And maybe you need 15 minutes to start, but 30 minutes for them to get to the next one. It just really depends on the specifics of your organization and how you see the process unfolding. And then this is a really important, let customers manage their own appointments. So what this means is, let's say they've already scheduled an appointment. Now you could have a coordinator schedule appointments, and I'll show you how to do that in a little bit. But let's say that someone goes and schedules an appointment, but then they have to reschedule. This gives them ability to do that. Now this next one's a little confusing price. That's not really applicable to what we're doing here. So you just want to set this to free. This would be more, again, if someone was, I don't know, cutting hair or scheduling a counseling visit or something where there was a copay or deductible there, then you could set the price. But for this purpose, it'll be free. So the price won't even show up on the email once it gets generated. All right, now custom fields. You're probably going to want to modify this to have some custom fields to get more information for your patients and loved ones who are visiting. So you can require things like, for example, the person requesting the visit is going to probably need to give their email for sure, a phone number. One thing I'll talk about here in a second, this actually has the ability to do text messaging, which is a huge win. Also, it will remind folks via text messaging. So that's really going to cut down on your no-shows as well. You can skip the customer address, but customer notes is good. Actually, I would put, you know, you want to just be very careful of PII in here, but also customer address is a good way to validate. So that's up to you, but I'm going to leave it out. And then you can go here and go add a question. And we're going to do a text question. So the first question is, how about patient's name? We probably should know that. Oh, and I misspelled patient. Let's fix that. Great. Save. Okay, and then I should make that required. And then I'm going to add another question. How about are you the one attending the e-visit? Save. Let's see. Text question. Let's go. If not, who? Save. And then let's add, actually, let's do this. Let's add a drop-down question that we're going to call location. And I'll say hospital, nursing home, clinic, spell these right, great. And I'll hit save there. And then I'll add one more room number. Oh, so that one would be a text question. Great. And I have one more question. Is this a special event? Okay, save. Now, this is very flexible. You can also go in and just one quick tip, you have to click these to make sure they're all gray. And then you can make some things required, like we really need to know the patient's name. We need to know the location, the room number. Maybe not room number because they may not know that. And you could skip, is this a special event? Great. I'm going to say okay. So we've gone through and we've added some special notes. Now, do we want to enable text messaging? Yeah, absolutely. And then let's see, use the default scheduling policy. We've already set that up. Staff, great. All right, this is looking good. Now, one thing, you'll look over here, you can check your staff. So I'm going to choose Angela and myself. That will be our resource staff. But again, this could be a whole lot of folks. You could have literally 100 people here that you choose and that you could set up special hours for as well. So I'm going to go save. Great. Now I'm going to go here to the bookings page. And there's a couple things. Now, when using this, you can require folks to have a Microsoft 365 account. That is not really going to work for us right now, so we're not going to do that. Also, we don't want this being searched and indexed by Google because we don't want these coming up from there. You could throw in a data consent policy so that obviously people are sharing their information with you. So you could just add please consent. I'm sure that every organization has its own language around these things. We talked about time increments of 30 minutes. You can also go in here and kind of change your overall branding, color, display business logo as well. I'll do that. Always show time slots in business time zone. Let's see. Email notification, and then we're going to send the email. So basically, we want to also send out a meeting invite to the person who scheduled it. That's great. Oh, this is a big one. Get rid of this. Allow customers to choose a specific person. Now, that would be appropriate if, like, say you're getting your hair cut. But for something like this, you're going to have a pool of resources that are going to be bringing all of this different equipment in and setting things up. So the customer doesn't really care if, James or Helen, brings the card in. They just need to know the card's going to be there waiting for them when they, call grandma over Teams. And then this next one's important. Bookable when staff is free. So that means that based on the schedule for each individual staff member, you can book. So that gives you a lot of power in terms of setting up your resource pools and determine your times. Let's say that you're doing this in 4 different shifts, that you could set up those different shifts based in the resource hours, and only certain individuals are available for certain shifts, and they'll get emailed. But it's just going to be round robin, and I'll show you that in a second. All right. Another one's customers. Oh, wait a minute. Save and publish. Very important. I skipped a step there. So if I go back to the booking page, I've set this information up. The most critical thing is you have to publish it. So after you hit publish, you'll get a URL string that you can use for your Wonder Health eVisit form. And you can go directly to the Open Publish page, but this is going to be the link that you're going to embed into your website. You'll hide it in a short URL, but you have this link, and this link now allows anyone out in the world to try to schedule an appointment with a patient in your healthcare system. So we're going to go ahead and take this link. I'll just go copy. I'll say okay, and then we'll come here. Just paste that in there. And now you get this very lovely page for Wonder Healthcare and our nice logo. And you'll see this is our service that we had set up. And this is our e-visit service, 30 minutes. And we'll scroll down, and now I can choose a date. Now, one thing I wanted to point out is I kind of have standard working hours set up for our different resources that are going to be, setting up the carts and sanitizing and whatnot. So you see the ones that are grayed out here, there's no options. So those are Saturday and Sunday, but they do have availability during these different times. Now, again, this is completely customizable, and it's customizable down to the resource. So different resources can have different hours set up. Those hours will automatically populate in this form, so you can seamlessly add to that. But the cool thing here is this isn't pooling just one resource, it's pooling all your resources and looking at available time. So right now I'm going to say, okay, I want 11:15 on the 12th, and I'm going to scroll down here, and I'm going to go ahead and enter my information. Populate that out, and I don't think I need to give notes right now. I'll do the patient's name. Let's see. John Doe, and yes, I am attending, and we don't need to populate that one, and the location is going to be at the hospital, and it's going to be room number 456, and is this a special event? Yes. Birthday. Bam. And then I go, please consent. Now this could be the full language for the consent. And then do you want to get a confirmation text message as well, which I very much do. And because my phone number is populated, I will get a text message from that as well as an email. Now I'm going to go ahead and hit book. And some required information is missing. Your notes. Okay. So it is Dad's birthday. On the 12th. Please bring flowers. I don't know. Or a cake. Bam. Now, that was actually, I didn't mean to check required for the notes. So you have the option that any of these fields can be required or not. But let's go ahead and hit submit, or book, I should say. Now it's working on it. It might just take a quick second. And then what this is going to do is add it to the group calendar that we've set up for this particular service within Microsoft Bookings. So now all e-visits for this particular setup will be managed within the calendar of e-visit. All right, thank you for booking with us. Great, so I'll say okay. Now, we also get this nice page here that is also available via our email link, where we can go in and go a new booking, or, I could do that now, or I can say, okay, I want to also do a follow-up on the 14th at 10:15 a.m., and, I could do, the same situation. But now, first and foremost, so you can control, or I can also go back if I want, and look at that. I just got a confirmation email from in my inbox here. And there it is. And it's nicely formatted. It tells me the time, etc. And also it gives me a link to a Teams meeting, which if I click on that, that will be the Teams meeting that is used within my organization to manage and that visit. So each one is individual to it. All right, now let's go back and look at the calendar. Actually, before we dive back into the calendar, let's just do a quick recap. So we've gone here, we've created our Wonder Health top level page. We've gone in, we've defined who our staff members are. We have gone through and created our booking page with the core information we need here. And this includes just some critical kind of administrative things. And then most importantly, we've gone through and we've created our service. So our service lets us, define the name of it, the location, what the different staff members that will be able to apply themselves to that service. We've applied our hours, our buffer time, etc. So we've gotten all that set up, and then as soon as we were done with it, then we get a lovely URL that with a nice scheduling page that's pulling directly from our calendars, and we're up and running. Now we have to manage all of this, which is pretty straightforward because we're managing it via a calendar. Now within this calendar, you see here, we have the one visit on the 12th that we set up. Now, if I'm a coordinator, I will go through and schedule these up. Now, a little trick to be aware of is it's grabbing resources dynamically and adding them, and they'll be color coordinated. So right now at 11:15, a resource has been scheduled to provide that service for that particular patient at that particular time. Now, if someone else wants to schedule 11:15 on Wednesday, then it will go to the next available resources on that time, and it will color code them accordingly. So you'll see different resources color coordinated based on the staff color coordination here. So it's just a good way for the resource to see, what's going on. So I click on this as a resource, and I see, okay, this is great. I got a patient time, buffer, etc. And I see that it's been assigned to Angela Underdown. So now Angela Underdown will have the ability to go in and look at all the information related to this particular one. So the patient's name, for example, is John Doe, the hospital room. Angela will immediately get this within her calendar, and we'll see that. Now, let's say hypothetically that Angela is out of the office that day or gets sick, then the hospital coordinator can go through and change it to another resource. So, voila. Very straightforward to do. Or they can even go in and say, okay, I'm going to move this, but you know what? This is really a bad time for us. What if we move this to the 13th instead, of which now Wiley Underdown has the ability to take that time slot. Angela might be out for a little bit. So I'm going to say, okay, great. I'm going to hit save. And now it's moved to that. But more importantly, an email will be generated. It should show up in my inbox any second now, telling me, the person who scheduled the event, that the event has been moved as well. Now, let's say that you don't necessarily, you want all this functionality, but maybe you want to have people call in and schedule. Not as efficient as the form, but it's very straightforward also for the coordinator to come in and set up appointments for patients. Or well, let's say maybe that, that time doesn't look like it's going to work. What if we do it at 10 a.m. Great. I'm going to use Angela. And see, this updated email just came in letting me know that my time had been updated because of a resource constraint. So automatically, it's keeping it updated right there. Now, I can go in here directly and schedule. Thank you. The time, etc. And I can put the information in, such as, the patient's name. John Doe, location, hospital, room number, no, yes, or that's going to be NA actually. Peridot, free. Now, I'm scheduling this all up for this e-visit, but also, I need this person's email. I just taken care of this for them because maybe they stopped by the desk to ask my help or something, whatever the scenario is. Great. I hit send. And this will go ahead and dynamically update the group calendar with Angela as the resource. And you see again here how these are color coordinated. This one's for Wiley, this one's for Angela. And, again, you can have multiple color codings here at these times, and then email will automatically be sent out to the client. So all this is historical, so you can pull out reporting, whether it's using Power BI or another tool out of here to show overall attendance, who attended, whatnot. You can also add fields for the coordinators. They can go back and check here and say, did they attend? You can add another field here to say, did the person show up? Did the meeting happen? Etc. So you can add traceability to your appointments very easily and do export for reporting. Then you can get the big picture view for the week or the month or the day, whatever it might be for the coordinator. So you can see that was just the appointment. I just had the coordinator schedule. So there's a lot of flexibility in terms of how you manage this. And again, if we go back into the appointment that it sent me, and I look at here, my Teams meeting, I can go in, and if I already have Teams, it will prompt me to join that meeting. Or if I don't have a Teams account, there's a very simple process where I just give it my Gmail account or something like that, and it will allow me to set up Teams to leverage for that appointment. So that is an extra step. If someone's not using Teams, they'll be prompted to go ahead and set up Teams. But once that's done, that's a one-time step, and they can just leverage Teams in the future for all future appointments moving forward. So just to recap, we've taken something that's a pretty challenging process, and within a matter of an hour, we've created a new sort of workflow process that can be very easily leveraged with healthcare systems. You have total reporting here. You have the ability for authorized individuals to manage this content, to make changes, to updates, to track it, to have traceability. These emails are being sent to specific resources that have to do the job, so they're accountable to the work that they have to do, and they know what their schedule is, so you have full scheduling. You have a link that can be disseminated via email or a website and updated very easily by the loved one who wants to visit the patient. And you have total traceability in the whole process. You also have a mechanism for tracking staff hours and availability, etc. And then also you have your customers. It's the same customer being me, but you see all individuals who are going to be attending and when, and you can get different track information about, well, how many times did this person visit, or how many times did this person schedule but didn't visit. So you have complete traceability in terms of your e-visit process. So this is just, I'm going to kind of wrap up there because I've thrown a lot of information in this kind of a longer video. But, when I thought through this, I actually have a client in Toronto who I implemented the solution for. And, this is something we were able to do in a week. And I think probably the longer part was just trying to figure out specifically what the client was looking for and then putting some governance into place. But this solution is a really rapid way to support specific challenges. But also, let's say that from a COVID-19 perspective, you have different facilities. Now you're starting to set up parking lots with tents in them, and you need to assign resources for those. You could set up parking lot 1, arena 2, whatever the location is, and have different scheduling mechanisms available for folks trying to schedule resources outside the norms of your traditional EMR framework, because suddenly your patient count has gone up 500%. You have these huge panels for providers, and you just need to find places to support your patients during COVID. This is an awesome solution for that. So, and again, we're all about at WonderHub, we're all about taking existing tools and coming up with quick, rapid solutions to problems like COVID-19. So again, my name is Perry. I hope you found this session helpful. Please don't hesitate to reach out here at WonderHub. And thank you so much for making time for us today. We really appreciate it. Just keep in mind, anything having to do with email, texting, all that, you can get that done within 365. You just have to think it through first. And here at WonderHub, we're here to help you with that. So again, thanks for your time. Keep up the great work, and we really appreciate you. Take care.